For those of you I haven't had the pleasure of meeting yet, my name's Sharon. I'm excited to invite you to my yoga practice today, something I'm going to call a yoga lesson in surgery. It's half of my general surgery clerkship project. The other half is a little note describing my thoughts about my experience as a clerkship student in general surgery here at the U of A and why I chose to build a short yoga practice for the general surgery clerkship student. In surgery, the days are long, the stakes are high, and the outcomes are not always ideal. Many students find the general surgery clerkship tiring both physically and mentally. So I'm here today to share with you a few simple postures to soothe the pain from hunching over the OR table, retracting for what can sometimes feel like forever, and dull the pain of disappointment at never quite picking the right things to read before you get pimped in the OR. Most importantly, it's something that takes only a few minutes when you don't have a lot of time to spare. To begin, find yourself a comfortable seated posture. I often find that sitting on a pillow or a folded up blanket is beneficial. It can help you to sit up straight and relieve some of the pressure in your lower back. So gently close your eyes, take a nice deep inhalation. When you've filled your lungs as much as you can, release that air with a nice big sigh. Continue to inhale and exhale, focusing on your breath. Let your day just slip away. You may have dropped the patient's chart on the chief resident's foot rounding this morning, frantically trying to write down a soap note, or contaminated the mayo tray trying to avoid the inadvertent elbow to the face in the OR. Or maybe you looked into somebody's eyes knowing that they were dying, or held a family member's hand in emergency after the resident gave them some really bad news. Whatever it was that challenged you today, just let it go. Learn whatever lesson there was for you, and release the experience and the emotions with your exhalation. Gently open your eyes, remove any bolster or blanket that you might have underneath you, and we're going to gently shift into a tabletop position. So shoulders over your wrists, knees under your hips, and on the inhalation, extend your back and tilt your head up to the ceiling. On the exhalation, you're going to contract your abdomen, arch, and curl your back up towards the sky. Inhale to flow forward, and exhale to arch your back like an angry cat. Just continue through a few more at the rate of your own breath, inhaling and exhaling. I find this stretch is really good for the lower back. I found it really useful after the long days in surgery being scrubbed in. Many of my classmates had the same thing to say. To stretch out those restless and aching legs, let's push back into a downward dog. You can pedal the feet here or sway your hips gently from side to side. Remember that the objective here is not to get the heels to the floor, but to straighten the back and broaden the shoulders, which should feel really nice after a long day of being hunched over in the OR. On the next inhalation, lift up your left leg, keeping your hips parallel. Exhale to bring the left knee to the left elbow. Inhale to lift. Exhale to center. Inhale to left. Exhale, left knee to right elbow. Inhale to lift. On the next exhalation, we're going to step through the hands and into a lunging position. Now, if it feels better for you and your balance is maybe a little bit off, you can always lower this right knee down to the ground. Place your fingertips on the ground beside your left foot and reach your left arm up to the ceiling. On the inhalation, think about lengthening the spine. And on the exhalation, find space and invite the twist. Inhale to bring the hand back down to the ground. Push back into a downward dog. And on the next inhalation, we can again lift the right foot and continue the flow on the opposite side. To complete our practice, we're going to stretch our achy toes in the upper back. Trust me, this may seem kind of disgusting. I was a little skeptical at first too when I saw it in class the first time, but it'll feel so good after being stuck wearing shoes, no matter how comfy, all day and all night while on call. What you need to do is take your fingers and interlace them between your toes. I said it was kind of a little gross, maybe, for some people. Same thing on the opposite side. You can give them a little massage if you like to. In the next inhalation, we're going to passively round the back, so no need to keep it straight, and just release yourself over your legs. Inhale to fill the back body, and exhale to release. When you feel as though this posture is complete for you, slowly find your way back into a seated position. I'd like to close the practice with some deep breathing. Often when we are so focused on getting things right, we're holding instruments just so we hold our breath as well. I'm going to invite you to find Shiva Linga Mudra, a resilience mudra, to fortify you to break down negativity. First, make a fist with your right hand, with your thumb extended, and place it in your cupped, upward facing left palm. This gesture is reminiscent of a mortar and pestle. Close your eyes and visualize something that challenged you, emotionally or intellectually, during your day in the OR or the clinic today. Move the right hand in a circular motion in the left as if you were grinding the feelings to powder. When you are ready to open your eyes, gently blow the imaginary dust away in a gesture of dissolution. If this doesn't fit for you, then please feel free to adapt this integrative part of the practice to your needs. You can either remain seated with your eyes closed and continue to breathe, or if you're familiar with it, you may take Savasana or Cobra pose. Lying with your legs extended and up a wall is also very nice, especially when you've been on your feet all day. Thank you for joining me for this practice. I am happy to share with you the small joys of movement, relaxation, and just one potential way to help deal with the challenges of a busy and demanding surgical rotation. It's a good stretch for an achy body, but mostly it helps me deal with the pain and suffering I see my patients go through, because that hurts me too. Namaste.